Please start. You are audible.
Okay. Good afternoon, everyone. Uh, I'm Professor Dr. A.K.Gupta, homeopathic consultant based in New Delhi. And today, on this particular webinar, I will like to speak on the respite to ALS and MND patients, motor neuron disease patients with homeopathy. This is I've been conducting a clinical study for over more than 600 cases of, ALS MND. We have been treating at AKGsOVIHAMS Medical Center, which is home with the Institute of Homeopathy and Allied Medical Sciences. As you all know, in present day, when we talk of any project or any study, we need to normally go in for the aims and objectives. For this, in this particular case, the study of the effect of homeopathic treatment on the progression of the degeneration, thus enhance the lifespan of the patient. To see the efficacy of homeopathic treatment on the improvement of quality of life of the patient, to bring about the symptomatic improvement, and all the cases which we seen were pre-diagnosed cases with the help of MRI, EMGs, NCVs, etc. by neurologists. ALS, also known as amyotrophic lateral sclerosis or motor neuron disease, or it is also called Low-Greenberg disease, which was first described in 1869 by Jean-Martin Charcot, a French neurologist, brought to international attention when the baseball legend Lou Gehrig was diagnosed in 1939. Motor neuron disease are a group of neurological disorders that selectively affect motor neurons, the cells that control voluntary muscles activity, including speaking, walking, breathing, swallowing, and general movement of the body. The disease came to the notice worldwide when the celebrated scientist Mr. Stephen Hawking was diagnosed with ALS, the most common form of MND, and he was the one who was survived the maximum span of life of MND. ALS refers to a specific subset of the pathologically identical diseases, other diseases of the motor neuron that should not be confused with ALS. MND include spinobulbar muscular atrophy, spinal muscular atrophy, Charcot-Marie-Tooth disease, Lyme disease, and many others. MND is uncommon degenerative disorder of motor neurons, which leads to the progressive paralysis of cranial and skeletal muscles. The most serious onset may include stumbling, weakened grip, hoarse voice, cramp, or muscle wasting. The condition is incurable and leads to death within a few years of diagnosis, generally first 1 to 5 years. Death is most commonly due to the respiratory muscle weakness and ventilatory failure. Well, this has been the usually it's been thought of. Anterior horn cells, lower motor neuron lesions, corticospinal tract cells, upper motor neuron lesions, and motor nuclei brainstem, both upper and lower motor neuron lesions. Sensory lesions are rare. Now, coming to the causes, about 90% of the cases of MND are sporadic, meaning that the patient has no family history of ALS and the case appears to have occurred with no definite known cause. Genetic factors are suspected to be important in determining an individual's susceptibility to disease. some weak evidence to suggest that onset can be triggered by as yet unknown environmental factors. Where the skeletal muscles are innervated by a group of neurons, low motor neuron, located in the ventral horns of the spinal cord, project out to the muscle cells. These nerve cells are themselves innervated by the corticospinal tract of upper motor neurons that project from the motor cortex of the brain. On macroscopic pathology, there is a degeneration of the ventral horns of the spinal cord as well as atrophy of the ventral roots. In the brain, atrophy may be present in the frontal and temporal lobes. On microscopic examination, neurons may show spongiosis, the presence of astrocytes, and a number of inclusions including characteristic skin-like inclusions like banana bodies, small eosinophilic neuronal inclusions, and vacuolization. ALS tends to be focal in onset with particular group of muscles affected first. The present mixture of upper and lower motor neuron features with a wasted fasciculating biceps with a brisk, easily obtained biceps reflex. In the recognized patterns, limb onset, which is the most commonest, bulbar onset, which has around 30% of cases, and respiratory onset, which is the least common. The rare variants presents in two ways. It's pure upper motor neuron features, that's primary lateral sclerosis, and pure lower motor neuron features, progressive muscular atrophy. Memory and intellect usually remains intact. Cranial nerves affecting sight and lower sacral segments of the spinal cord affecting continence are spared. Varied presentation and unpredictable, sometimes very rapid disease progression. Progressive bulbar palsy affects 25 to 30% of the cases. Both upper and lower motor neuron may be involved and characterized by dysarthria and dysphagia, with lower motor neuron, nasal speech, regurgitation of fluid via nose, tongue, atrophy and fasciculation, pharyngeal weakness, upper motor neuron damage. There could be tongue spasticity, explosive dysarthria, emotional lability, affects older women predominantly, and average survival rate is 6 months to 3 years. In progressive muscular atrophy, which is least common, is around 10%, predominantly lower motor neuron degeneration characterized by muscle weakness and wasting, weight loss, and fasciculation. It usually affects men predominantly, and average survival rate is considered to be 5 years plus. As the disease progresses, there may be considerable overlap resulting in more generalized muscle wasting and weakness. The motor nuclei controlling eye movements and the voluntary pelvic sphincter muscles remain intact. Silent symptoms, it has been mentioned in the books that it used to start from 50 years and above, 35. In certain books, it has been given 35, 50, 70. And in my practice, I have seen as young as 18 years old, patient also, which case I'll be discussing also, has been suffering from ALS. So the age is no more a criteria. Muscle weakness, wasting is there, fasciculation or twitching is there, spasticity or the stiffness in the arms and legs, overactive tendon reflexes, dragging of foot, unilateral muscle wasting in the hands, slurred speech, choking and suffocation, difficulty in swallowing, especially the liquids, and increased salivation. The clinical presentation could be the twitching, which could be anywhere in the body, stiffness of the neck, wasting of the muscles, that's called emaciation, muscle aches, cramps, stiffness of the body, weakness and fatigue, clumsiness, tendency to fall, stumbling, excessive salivation, dribbling of saliva, slurring of speech, total loss of speech, and difficulty in chewing. Quite a good number of patients complain of present with choking, difficulty in opening the mouth, difficulty in protruding the tongue, difficulty in swallowing, difficulty in breathing, difficulty in raising the hand, laughing inappropriate, crying inappropriate, difficulty in sleeping, difficulty in turning in bed, weak grip, and difficulty in walking. These are the another presentation, and we need to understand the upper motor neuron, dysfunction and lower motor neuron dysfunction. With this, we can understand. In upper motor neuron, we got a pseudobulbar effect, moderate weakness is there, spasticity is there. There's a plantar reflex, which are hyperreflexia and extensor plantar reflexes. And low motor neuron, there is severe weakness, fasciculations, muscle cramps, muscle hypotonicity, muscle atrophy, and hyperreflexia. There is no diagnostic tool as such to diagnose MND. And this is a very strange and unfortunate that we cannot have till date come out with any particular test or investigation which can confirm the disease as motor neuron disease. In investigations such as blood test, electromyography, EMG, MRI, and sometimes genetic testing are useful to rule out other disorders that may mimic MND. However, the diagnosis of MND remains a clinical one, having excluded other diseases. A relatively rapid progression of symptoms is the strong diagnostic factor. Although an individual's progression may sometimes plateau, it will not improve. Diagnosis of ALS is very difficult because ALS mimics many other neurological diseases and disorders such as multiple sclerosis, spinal cord tumors, or nerve compressions. ALS is usually diagnosed by ruling out other possibilities diseases by EMG, NCV, MRIs, and CAT scans. Blood routine, CPK, MuSK, thyroid profile, lead, mercury, arsenic, and copper and magnesium are another test which need to be carried out along with the ACTH kind of a thing. We are able to, see things the patient might be having underlying. Treatment. Currently, there is no cure for ALS or treatment. This is what is usually believed and talked about, and the Google has been saying all through, but which is not true completely. The only drug that affects the course of the disease is xylazole, commonly known as Xylitol. The drug is supposed to be function by blocking the effects of the neurotransmitter glutamate and is thought to extend the lifespan of an MND patient marginally. In my study over 600 patients, I have seen majority of patients, those who had been taking xylazole, have not shown any effect, barring a couple of cases where they felt that it has been able to slow down the progression. Latest in offspring is a stem cell treatment, though not many cases have been reported. On the contrary, I have got number of cases those who have taken the complete, 3 or 4 cycles of stem cells with no relief, or on the contrary, few of them, the patients got, their problems have increased. The other edaveron injections are the latest introduction from the USA and Japan, but again, it has also not been seeing a very promising as such. Physiotherapy and speech therapy should be used as an auxiliary measure. No treatment and hope is a challenge. This is what the patients are told by the doctors and neurologists in the hospitals. And at AKGsOVIHAMS, we have come across several patients who previously have had very unfortunate and negative experiences with the doctors, straight away telling them that there is no treatment or hope left for them. When a doctor, usually considered only second to God, gives such a statement, it completely breaks the morale of the patient and his and her family members. Such insensitivity and lack of professionalism on the part of the doctor can initiate a vicious cycle of shock, anxiety, despair, hopelessness, depression with the patient and his her immediate family members, staring down the fast approaching and unacceptable death. By the time the patient and his her family members consult another professional for a second opinion, the doctor's words, there is no treatment, have almost hijacked the patient's belief system and caused significant damage, which becomes a major hurdle in responding to any form of subsequent treatment and recovery. So, this is a very, very important uh, aspect and point that though I agree that this is not a very easy disease to treat and tackle, but giving such a negative remark to the patient on the face of the patient and telling that you have got a very limited period of time and every day you are going to go down and down and things will become almost very difficult, completely paralysis and all that. So this and there have been quite a good number of cases, those who were told like this, but later on they were, on going for further investigation and all that, they were, aware that this particular problem has not been that bad, though it has been there, but after going in for some other therapies and all that, the patients have started improving also. Now, ALS and MND, with the homeopathic approach, MND is a fast progressing degenerative disease, devastating illness which leads to progressive paralysis and eventual death. It is considered to be an incurable disease wherein modern medical science does not have much to offer. At AKGsOVIHAMS, encouraging results have been obtained with homeopathy, and that's what made me to go in for a clinical study for this particular disease and the research. Homeopathic approach. Those who are, aware of the homeopathy, we've been talking about the miasmatic background is a basic, disease-causing agent. So MND is a combination of all chronic miasms, psychosis, and syphilis, resulting into the complex mixed miasm. Predominantly, it falls into the syphilitic miasm. Though constitutional similum is a dictum, but to find it out is a very difficult. As MND is a fast progressing degenerative disease, remedies with regional affinity are equally required and effective. Our observation at AKGsOVIHAMS, a very important aspect has been made in the study of around 600 cases that MND patients usually are very, very sensitive. They are highly principled people and have some kind of a history of injustice or pride hurt, or they have undergone some false accusations or had been a silent sufferer of loss of position or honor wounded, despite being highly placed. In my 600 cases, I think I have been able to elicit this particular phenomena or their problem in around 75 to 80% patients of mine. They did have some kind of this kind of a situation, though they've been having a very high, occupying a very high position, like they've been lecturers, principals, doctors, advocates, or big officials, businessmen. But at some stage of their life in the past, they definitely have been having some kind of a mental trauma which they've not been able to overcome, and probably that has resulted into this problem too. In our study, we find around 37% have been a female patient and 63% have been a male. The following set of symptoms of the patients were observed. We came around 76% of patients who complained of slurred speech or inability to articulate properly. Well, this was just to see the speech, and 69% of the patient reportedly improved. Difficulty in swallowing, 57% patients had this problem in the first time, and 51% patients felt improvement in swallowing. Choking was another symptom. The 47% of MND cases, they did come with this particular issue. And out of that, 58% of the patients were able to get some relief. Symptoms of tongue, we encountered around 28% of who reported with some kind of a symptom pertaining only to the tongue. For example, heaviness of tongue, fasciculation of tongue, sensation of tongue rolling inside, and odd sensation of some foreign body on the tongue, and tongue gets shriveled and retracted. Out of those, 68% cases were completely relieved of these symptoms. Salivation has been 66% of the cases complained about increased salivation. 52% showed improvement. Generalized weakness, 86% patients complained of generalized weakness and weight loss. Out of these, 48% are reported to have benefited and feeling more energetic in general after taking the homeopathic treatment, though not many gained weight. Fasciculation is the very common feature which we have been coming across, and it's around 88% of the patients of MND ALS, they have this fasciculation symptom, and 82% patients have definitely shown good relief. The tendency to fall, 39% patients have shown this tendency, and 60% patients out of those have been benefited. And there have been patients, those who have been having the tendency to fall, some get the tendency to fall forward, some fall backward, and some to the sidewise. These kind of information, if we get, that helps in selecting our homeopathic remedies too. So it is important for our doctors and the patients to give us the maximum information. Coughing is a 44% of the patient, they do cough, and 50% of the patient after taking homeopathic medicine have been improved with that. Difficulty in neck holding. Now, this 28% came with the problem of difficulty in keeping the neck stable. 50% patients were wonderfully helped with homeopathy and were able to hold up their neck properly. And this was a case where, I mean, you can see the patient's neck had been tied with the headgear with the chair to give it a support to keep the neck straight. Difficulty in fine movements, 17% patients reportedly came with this practical issue of buttoning the shirt, sewing, writing, or clapping. And 34% did show improvement. Emaciation, 37% patient reportedly came with the progressive and rapid emaciation. 51% of them showed no further wasting, though not gained the muscles, barring a few. This particular area still needs to be worked more. Now you can see the emaciation of the patient is all muscle gone, it's all bony structure left. Neck holding difficulty is the same patient with a, they tend to use collar to keep that, up. And there's a tendency to fall and unsteady gait. This is the typical gait which you see the patient becomes unstable. The tongues with the fasciculation on the tongue. You can see it is very, noted down. And this tongue has been shriveled and with the tongue feeling of some foreign body. Specific group of medicines effective for particular aspects of MND at AKGsOVIHAMS, which we have found out. Difficulty in swallowing. These are the group of medicines I have found to be useful. Choking in throat, These were the medicines: arsenic, causticum, calisanitum, lachesis, lysine, difficulty in speaking, causticum, hyoscyamus, calisanitum, lachesis, mercos, stramonium, tendency to fall, again causticum, ferrum, gelsemium, natramur, phosphorus, rustox, acid phos, zincum, and holding neck difficulty, calcarea phos, gelsemium, calisanitum, increased salivation, helleborus, lysine, moxol, and syphilinum. Weakness of the limbs: arnica, arsenic, bryonia, causticum, curare, gelsemium, lathyrus, rustox, and strychnine. Foot drop: causticum, natramur, plumbum, rustox, zincum. Dragging the limb with while walking: conium, lachesis, lathyrus, plumbum, rustox, and sickle. Emaciation: calcarea iode, calcarea phos, causticum, iodium, lachesis, lycopodium, natramur, stannum, and sulfur. Regurgitation of food: aurum, carbolic acid, carboveg, causticum, mercor, uric acid. Gait disorder: agaricus, alumina, conium, gelsemium, lecananthus, lathyrus, picric acid, rustox, strychnine, and zincum. Twitching and fasciculations: agaricus, gelsemium, hyoscyamus, lysine, minianthus, phosphoric acid, plumbum, strychnine, tarantula, zincum. And we're coming to the case. Now, this is a very interesting case, as I said initially, that when we're talking about the onset of the disease is around 35, 40s, 50, 70. So this particular gentleman, he was 18 years old when he came to me on 26th of December 2019 with a complaint of weakness in the body since 18 months, weakness especially in lower extremities, weakness in legs, unable to get up and walk. Complaint started from lower extremities with wasting of muscles and weakness 18 months. This was a condition initially. The child, the young grown-up boy was being carried by his father in his arms to be taken. So you can understand the plight of the family. A well grown-up boy has to be dependent on his father. There was a history of urinary infection followed by weakness in extremities around 1.5 years. History of fall on the back and got injured, and 1.5 years ago, complaint started after the fall. He was unable to walk and stand on his own, has to be carried on lap. There were fasciculations, twitching of muscles, wasting of muscles with emaciation and weakness, generalized weakness in body, stiffness of necks, sometimes urine of mud color, offensive, semen emission, spermatoria. You can see this wasting. The patient was unable to get up from the chair. This was a wasting. You could see the wasting have been of the muscles is so profound. There have been fasciculations. This was all on the day when he came. There was a history of masturbation, weakness in body, and gestational history was a premature baby, 7-month-old, and no vaccination was done. This was important that, there was never, any vaccination was given. That he used to have a lot of lascivious dreams, and suddenly he gained a height in 2016. Very social, friendly, wants to be in company of friends, feels happy when people come to see him, weeping tendency, emotional, anxiety about his health, likes traveling. Wasting of muscles, you can see the degree of wasting. In investigation, vitamin D was low, 15.5, vitamin B12 was high, 2000, calcium was, 9.4. His ANA was positive, magnesium was 0.95, and HCV was positive. EMG suggestive of neurogenic disorder, and CPK was 73.6. The remedy given was, this, and on this February 2020, there have been slight difficulty in swallowing, and sleep has improved, headache in temporal region, crackling in joints present, night emission with weakness in body. Investigations done after that, ANA became negative, CPK also improved, vitamin D also improved. Medicine given was acid phos and plumbum. Complaints were better. Pain in June, pain in back, difficulty in turning on bed, a night emission 2 to 3 times, vertigo with darkness before the eyes, generalized weakness, and within 7 months of medication, he can walk with support. This is on 22nd of July, 2020. In August 20th, the 8 months of medication, he's feeling much better. He's able to walk, no more giddiness. Now he's able to stand, which he used to be finding difficulty. He's able to walk around 25, 30 steps. This was all, within the time frame of 8 months. This was 30th September, and 9 months. Says that now in the month of October, there is another follow-up. Now he can walk around 40, 50 steps to, under 200 steps. This is in October 2020, at the treatment of 10 months. Now he is able to get up without the support from another person. Though it has been a difficulty, but still minimum support from the other person. A follow-up is in the month of December 2020, that is almost a year. You see which were a lot of wasting has been filled up now. Now finally, without the support of another person, taking this support of another person, finally he could stand on his own with his hand support only. He needs a very less support from a person while walking and can make the balance. Now the treatment started till January 2021. Trembling in the legs have improved. Now started to climb stairs with support. In 13 months of the treatment, now he is able to climb stairs and go down, though he needs the support, but he is able to climb the stairs. This was in March 2021. In the 15 months of treatment, patient now able to get up easily without much effort. And during these auxiliary measures, which were given is the physiotherapy, protein diet, meditation, and exercises, along with the medication. Started walking around 500 meters and climb stairs 5-6 times in a day now. Okay. Now the patient is able to stand for some time on his own and he has gained weight. The treatment continues. The remedies used were Staphylococcus, acid phos, curare, zincamet, and cocculus. In the month of June 2021, complaints were better. Now walking up to 1 kilometer. There used to be back pain, worse after the long time sitting, muscular atrophy of the fingers, especially left hand, burning in urethra, and gas formation. These were the symptoms. Now you can see that with the comfortably, he's been able to get up from the same chair, much better in general, and fasciculations also much lesser with reduced trembling and able to get up on his own and walk without much support. Even a bit apprehensive of walking without, taking a support. In this period of time, he had COVID vaccination, and after taking the COVID vaccination, the weakness has increased immediately after the vaccine, especially in the legs. Feels heat in leg, profuse perspiration, especially legs after the vaccine. The previous slide, you could see that he was able to get up much comfortably, but now, so this has been the bad effect of vaccination. See, the patient who had improved tremendously, that he could stand without the support on his own. Follow-up was weakness after the vaccination. We had given the medication. The weight loss which he had in between, he started regaining and got up to 72 kgs, and weakness improved. The weakness which he has developed after the vaccination has also improved after the homeopathic treatment. It was in December, then January 2022, he had dengue fever for 15 days ago, and the platelets had gone down as low as 25,000. And then he was having fasciculation, which had started for the last couple of days back, and which the unbalancing was also there, but became better. In the March 2022, there was a backache, which became much better. Fasciculation increased, especially in the legs, but overall better. And on 5 days ago, he had a fall during doing the sit-ups. Now you can see the back to normal state. Almost standing, walking, all on his hello. Okay. Mm, it was after 18 months. Now you can see the walk, the comfortable walking. These medicines used were acid force up to 10 m, Staphylococcus 10 m, up to 10 m, Naphthalmica up to 1 m, Thuja 1 m, Plumbermet 200, Sina, Curare, and China. Now it's been 2 years. Now, within 2 years of medicine, after he's completely all right, now the medicines have also been stopped. Now from this, now he's the same patient. Battle against has been won with homeopathy as the main weapon. I would, leave these medicines because the time I've been asked for the short time. And some medicines will forget. This is the conclusion of homeopathic medicines, how much the efficacy has been shown. Though not claiming a definite cure, homeopathy surely has ensured respite from this dreadful disease by slowing the fast progression and of degeneration. It has improved the quality of life and increasing lifespan. Let us put the best efforts to bring an end END to the MND. There have been a couple of videos which of the patients can be seen if the time permits. We can go quickly. The kind of different patients have shown 50% better. Now, this is important. This is a wife of that patient who has been telling